Good morning, everyone. My name is Fredrick. I'm the Regional Nutrition Advisor for Africa for Helen Keller International, and I'm based in Dakar, Senegal. This morning I'm going to talk about our experience with homestead food production programs and share some results from some recent research we've done in our programs in Nepal and Burkina Faso. So Helen Keller has been implementing enhanced homestead food production programs for over 20 years now, initially as a food-based approach to vitamin A deficiency in Asia. And over time, this approach has expanded in scope. But at its core, it's about home gardening of nutrient-rich crops, as well as small animal production, with a very strong engagement of local civil society, government extension services, and the private sector, as well as delivery of evidence-based essential nutrition actions. And these are guided by a behavior change strategy that is informed by formative research. So in a sense, it's a nutrition-sensitive agriculture program with nutrition-specific activities. In Nepal, we're working in the far western region, which has very high levels of stunting and anemia, low food security, and low dietary diversity. And through the Enhanced Homestead Food Production Program, we've been able to deliver nutrition services to over 200,000 women and support over 11,000 home gardens. This is significant coverage of the target district, over 40%. And here we conducted a cluster randomized cross-sectional surveys in 2009 and 2012 to assess the impact of the program on children under the age of 2 and women of reproductive age. Along with that evaluation, we conducted regular process evaluations for program monitoring. And we have had some significant nutrition impacts. Infant and young child feeding practices have improved. Mothers are significantly less likely to be anemic. Non-pregnant mothers significantly less likely to be underweight, and children less likely to have anemia. We've seen impacts across all of the impact pathways, particularly agriculture and perceived food security, with the exception of growth. In Burkina Faso, we have a different environment. This is a Sahelian context with chronic high food insecurity, chronic high stunting and wasting, as well as extremely high anemia. Here we've been delivering our nutrition services and messaging through both communities and facilities, health workers as well as older women leaders or grandmothers. Over 1,200 home gardens have been supported that are producing fruits, vegetables, orange flesh sweet potatoes, and small animal production. And in Burkina, we collaborated with IFPRI on a cluster randomized impact evaluation. This looked at, again, the impact of the enhanced homestead food production on children 3 to 12 months of age. And as in Nepal, we conducted regular process evaluations for ongoing program monitoring. Here we've also had positive results. In terms of nutrition, there were significant treatment effects on both knowledge as well as practices around infant and young child feeding. There was a modest improvement in child anemia, the treatment effect on hemoglobin concentration, in infants 3 to 6 months of age. And one of the reasons we think that we've only saw this impact on the youngest infants relates to the process evaluation that was conducted at midterm. And this revealed that knowledge around anemia prevention was quite low. So there was an effort made to retrain health workers to strengthen anemia prevention messaging in the behavior change delivery. And that happened in the second half of the research period, which is why one of the reasons we think that the youngest infants are the ones that benefited from this. We did not see a change in child growth. There was no impact on stunting. One of the other challenges we had was that there was a 6-month delay between the baseline assessment and the program implementation for a number of reasons in terms of getting the program underway, the time it takes to get the research model and the program impact pathways detailed, and the actual agriculture interventions set up in a new setting. And so this also meant there was a loss. We missed 180 of the first 1,000 days. So what are the lessons learned? Well, obviously, nutrition impacts are possible in multi-sectoral agriculture programs. We had good experience with the infant and young child feeding practices, with anemia, and with women's anthropometry. I think critical to this also is the timing of the program, as well as the sequencing of service delivery. And especially important is having a very rigorously designed program impact pathway based on a theory of change, and I'll talk about that in a minute. Another very important lesson learned for us is just the importance of partnership between research institutions and implementing agencies. This ensures that not only do you have a well-designed program that is likely to achieve impact, but we can measure that impact. It also allows for regular program monitoring and course correction when problems are identified, as we did in Burkina. We've talked a lot this week about multi-sectoral programs, agricultural programs. I think as the more multi-sectoral the program, the more complicated the impact pathways and the more challenging it is to detail those out. But we shouldn't let that discourage us from partnering with research bodies, because these are the types of programs that need that need rigor that much more. Another point regarding research is in both of these projects and many of our projects, we begin with formative research to identify the socio-cultural context that we're working in. This informs the behavior change strategy so that we can deliver nutrition and agriculture programs in a culturally appropriate manner. But it also ensures that we're assessing gender and other constraints so that we are doing no harm. And so these are another important, critical component of research and programs. And finally, the timeline. We're always under pressure to show results quickly, but we also need to look at what is feasible for both the research, for both agriculture interventions, for affecting behavior change. And 3 to 4 year timelines is probably not enough. It makes it very tight to have an impact on the first 1,000 days. It's absolutely impossible to have an impact on pre-pregnant girls and women if we want to have an impact on the next generation. And just to conclude, I think despite the difficulties that we've talked about this week in having an impact on stunting, on anemia, on nutritional outcomes through multi-sectoral agriculture programs, I think our results show that it is possible to have these impacts, but we also need to continue the research to look at this more rigorously and to better understand how we can continue to have these impacts and to strengthen them, and how we can apply, how we can intervene in different contexts to achieve these results. So thank you.